This is lecture 10, and we're now going to finish the upper extremities. So we're going to talk about the ulna and the radius, how it articulates with the humerus, and then move through the arm and down distally to talk about the wrist and the digits. I wanted to add these two images before we talk about the features of the bones, because I forgot to put these in the last lecture, and I just wanted you to have an overview with a picture from your textbook that had all of the muscles that we talked about for the pectoral girdle. We started to mention some of the muscles that work at the humerus, and I thought it was important to show you all of the muscles together. Don't forget that when you see these images from your textbook, that one side will be superficial and one side will show you the deep muscles, so you can get an idea of how these muscles are in the human body and how there are layers. So you can see the pectoralis major muscle here and how it is inserting into the humerus. You can see the deltoid muscle. We talked about those, and then we talked about some of the muscles that had to do with the rotator cuff, and we have yet to talk about the biceps brachii muscle, which we will talk about at the end of the lecture. But I wanted you to at least be able to see these images taken straight from your book, so you can see all of the muscles and how or where they are located with respect to the other muscles that I talked about. So you can see teres minor here. You can see that teres major is going to insert much lower on the humerus. So I just wanted to make sure that you had these slides as well. We already went over the lats, the latissimus dorsi. And now let's begin talking about the radius and the ulna. So these are the bones in the forearm. And it is important to note how these bones, or the orientation of these bones in anatomical position. So the radius is lateral. Remember, in anatomical position, if we're standing, our palms are facing forward. So the radius is lateral and the ulna is medial. So make sure that you understand the orientation of these bones. And now we'll begin to look at some of the features of the bones, and then I'm going to highlight how these bones articulate with the humerus. Okay, so this slide is showing you the ulna and the radius side by side. And I want to first focus on this proximal end of the ulna and talk about a lot of these features. And I found another slide from Teach Me Anatomy that has these features color-coded. So I think I'm going to work off of that slide because there are some important features here. Remember that this region is what is going to be forming the elbow joint. Okay, so here is that picture from Teach Me Anatomy that I like. So it is highlighting the features that I want you to know. So you can see that this rounded area right here, that is called the olecranon. All right, the olecranon process is this little tip right here. And then there is a coronoid process. This is this area right here underneath kind of this C-shaped lip of it. And then this region right here is called the trochlear notch. And again, if you remember the trochlea of the humerus, that is why this feature is named that way, because the trochlea of the humerus is going to articulate with this trochlear notch. And I'll show you a better image of it too. And then there is the radial notch, because the head of the radius is going to articulate with a site on the ulna, okay? The olecranon, just to talk about this a little bit more. So if you feel your elbow as you are bending or extending and flexing your forearm, you can feel the olecranon protruding from that posterior region of the elbow. That is what you're feeling if you palpate that area of your elbow. That's the olecranon sticking out. There are not a lot of features to the radius, so it makes it somewhat of an easy bone to recognize and to be able to identify the features. So when you look at the radius, there's really only two features that I want you to know, which is the head of the radius and then the styloid process. So both the ulna and the radius have a styloid process that is sticking out toward the distal end of the bone. So let's take a look to see how these features that I just went over of the ulna articulate with the humerus. So I have two slides to lay that out and discuss that. So I have over here images showing you both an anterior view and a posterior view of how the ulna and the radius articulate with the humerus. So we were just talking about that trochlear notch. So the trochlear notch and the coronoid process of the ulna articulates with the trochlea of the humerus. So just to be clear, the trochlea of the humerus is going to sit in the trochlear notch of the ulna. You're also going to get an articulation with the coronoid process. So this lip right here is also going to articulate with the trochlea of the humerus, which is what I have spelled up here. So the trochlear notch and the coronoid process of the ulna articulates with the trochlea of the humerus. So it is really important to understand how these bones articulate with each other and have a good understanding of what features are coming into contact with the other bone. If we look at the posterior view, you can then see the olecranon process. That was that area I asked you to palpate at the back of your elbow. That it is going to articulate with the olecranon fossa of the humerus. Remember that fossa on the back of the humerus. All right, let's now talk about what the radius is doing in all of this. So we were talking about the ulna and how this region right here is articulating with the trochlea of the humerus. So what is the radius doing? So the head of the radius, right here, it has a cylindrical shape to it. And that is what is going to articulate with the capitulum. I guess it doesn't help that I'm using the same color. So the capitulum of the humerus is what is going to articulate with the head of the radius. So take some time to make sure that you understand how this joint is coming together, what parts of the humerus are articulating with the ulna, and which parts of the humerus are articulating with the radius. So this is to drive home that point again, that the radial head is articulating with the capitulum of the humerus. And then we have the trochlear notch and the coronoid process that is articulating with the trochlea. All right, so this slide kind of sums up all that I went over, and hopefully that is clear. I also added some images from your textbook of real bone so that you could see these features. I can highlight them here. Here's the trochlear notch. Here's the radial head, the coronoid process. The radial notch we went over, that is where the radial head articulates with the ulna. And then the styloid process of both the radius and the ulna are the features that I want you to know. It's also important to note that these two bones are held together by this interosseous membrane. This is dense, regular connective tissue that holds these two bones in place. Let me highlight the olecranon too. I want you to make sure that you know that as well. And then I think I have a couple other images from your textbook that highlight these articulation sites, and it has a more close-up view of it. So again, here's the humerus. Here is the trochlear region here. Here is the capitulum region here, and you can see how these two areas articulate with the ulna. So the ulna is here and the radius is here. This is the head of the radius, and here is the ulna. You can't see all of the features because this is an anterior view. I don't know what is happening to my spelling. I would take this time in lab to work with this joint. Use the full skeleton will help you see this joint. I don't think the individual bones will help as much, but if you look at a full skeleton and use the individual bones, you will be able to see how this joint clearly forms. All right, so let's talk about the movements of the forearm. These are movements that can occur at the elbow. So before we get into the discussion of muscles, we should always talk about movement so you can get flexion and extension at the elbow. You can also get pronation and supination. So this is turning like if you have the palm of your hand facing up, and then turning the forearm over. That is what is called pronation and supination. Oh, I meant to delete this slide. Oh well, it's in here. I'm not actually gonna go over the ligaments of the elbow. Sometimes I talk about the ulnar collateral ligament that is sometimes injured with pitchers and baseball pitchers. With extensive motion, but I think I'm going to leave this out for the sake of time and move on to, because we still have all of the bones of the wrists and the digits to go over. So let's move on to the bones of the wrist and the hand. So there are 8 carpal bones that form the wrist or the carpus. And these are 2 rows of 8 marble-sized bones. And I actually have a mnemonic for you to help you memorize and determine the order and the names of those wrist bones. And then we'll also talk about the metacarpals, which are the bones that are in the palm of your hand, and the phalanges, which are the digits, your fingers. So I think first we're going to talk about the metacarpals and phalanges, and then we'll come back to the wrist. So let me show you a picture of the bones that we're going to be talking about, and let's work through this. So you can see, let's first orient ourselves. So this is an anterior view, and this is a posterior view. Remember, anterior is palm out, facing forward. So you can also see the ulna and the radius here, okay? So something to note, I'm gonna point out again, is that the radius is articulating with the carpal bones, but the ulna is not. You can see the space between the ulna and the carpal bones. All right, I'm gonna come back to these carpal bones and give you ways to memorize them, but I wanna first take you to the metacarpals and the phalanges and tell you how the bones are ordered. So let's work here on this posterior view. All right, so this is the back of the hand. So the metacarpals are numbered, Okay, so they're right here. They're numbered 1, 2, 3, 4, and 5. The thumb is always number 1. So if I labeled any of these metacarpals on a practical, you would need to tell me what number it is too. So this would be the first metacarpal, second metacarpal, third metacarpal, and so forth. Okay, so that's how they're numbered and labeled. Those are the metacarpals. Let's then talk about the phalanges. So these are the digits, your fingers. They are also numbered the same way, okay? But there are 3 bones that make up the phalanges in 4 of the digits, and there are 2 bones that make up the phalange in the thumb. So the way that they are named is that there is a distal, a middle, and a proximal phalange. Now in the thumb, there is only a proximal and a distal. There is no middle. So here is the proximal and here is the distal. So this right here would be the first distal phalange. This one would be the first proximal phalange. And then if we moved to the second phalange, this would be the if I labeled, any of these bones here, this would be the second distal phalange, second middle phalange, second proximal phalange. And then you keep moving towards the 5th one. So I really wanted to go over how these are named and numbered so that was clear before we moved on to the carpals. All right, so the same would be true over here. Number 1, put your thumb up, is always the first digit or metacarpal or phalange, okay? And then the first finger is the second and so forth. So make sure that you have a good understanding of how to label the metacarpals and the phalanges. I think I have one other picture that has this color coded. So I think the first picture is from your book. This one color codes it so you can see the distal, middle, and proximal phalanges. You can see the metacarpals. Here are the phalanges. And you can see how the thumb does not have the middle phalange. This would be labeled 1, 2, 3, 4, and 5. All right, so now let's turn our attention to the carpal bones, and let me show you a way that I have memorized them. So this is a really great mnemonic because not only is the mnemonic specific to the bones, like it's not nonsensical. It has, some mnemonics have nothing to do with the subject at hand. This one does. It also gives you direction because depending on if I show you a left hand or a right hand, you need to be able to identify these carpals. Let me take you back really quickly to this picture so you can see the names of the bones, and then I'm going to show you the mnemonic and how it will help you. So the names of the wrist bones came from the shape that the bone takes on. So again, these are very small marble-shaped bones in your wrist, and their name, it kind of describes the shape that the bone is in. So we have trapezium, trapezoid, capitate, scaphoid, lunate, triquetrum, pisiform, and hamate. So let me take you back to my mnemonic now and show you how this mnemonic works. So there's 2 ways to kind of memorize the wrist bones. You can either memorize the wrist bones using their name and the shape that they take on, or this mnemonic down here. This mnemonic is straight line to pinky. Here comes the thumb. So straight line to pinky, you always want to start near the thumb and work toward the pinky because it's a straight line to the pinky. So straight line to the pinky, and then here comes the thumb going this way. So it's a clockwise motion. And again, the S stands for scaphoid, the L stands for lunate, the T stands for triquetrum. I'm not going to go over the whole mnemonic, but you get the idea of straight line to pinky. And then here comes the thumb. And then also, so just to be clear, this is the scaphoid, this is the lunate, this is the triquetrum, pisiform is here, hamate is here, capitate, trapezoid, and trapezium, okay? Another way is by noticing the shape of the bone. So scaphoid does look like a boat, lunate is moon-shaped, triquetrum is triangular, pisiform is a little pea-shaped wrist bone, hamate has a hook, you can see the hook here, capitate is the largest one, trapezoid shape, and then trapezium is a four-sided shape. So those are two strategies to memorize the wrist bones. Personally, I like straight line to pinky, here comes the thumb. But if all else fails, there are a few wrist bones that you can find, like hamate or capitate, that should orient you as well. So this will work no matter if you're looking at a left hand or a right hand, because you always want to start in the same place. You want to start at the thumb on the bottom row. So again, if this was in the other orientation, you would still be able to use this mnemonic and it will help you. So when you're in lab, spend time. We have these hand bones models in the lab where you can start to memorize the metacarpals, the phalanges, and work on trying to find ways to memorize the wrist bones. So this is to, again, drive home this idea that the radius is the only bone that is articulating with the carpals. The ulna does not articulate. There's a nice space there. Does not articulate with any of the wrist bones. All right, let's talk about boxer's fracture. Boxer's fracture is very common clinically, especially in the ER. This is when, so there is, according to like martial arts, there are correct ways to throw a punch and there are incorrect ways to throw a punch. And if you punch something and let me get my pointer, your hand is aligned this way. I mean, I'm not in class to show you kind of what a correct punch would look like, but this is causing a lot of force to occur, and what usually happens is either the fourth or fifth metacarpal takes the force of that punch, and you will get a fracture line on either one of these metacarpals. Usually it's the fifth metacarpal. So you can see it here on an x-ray. This is a typical example of a boxer's fracture. Then again, this is when you punch something. So if you get angry and you punch a wall or you punch a locker or whatever it is, and I'm using these examples because my son has done all of those. I think he's had 3 boxer's fractures to date. All right.